Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McRae.
When it comes to medical care, who decides when a patient can't? Well, here's what's interesting. Fewer than 30% of Americans have what's called an advance directive, or a legal document that outlines their treatment preferences that can also grant someone else the power to make medical decisions on their behalf. And without that legal document, a patchwork of state laws can make it confusing, to say the least, to navigate an incapacitated patient's medical wishes.
Recently, Mayo Clinic, in conjunction with the University of Chicago Medical Center, researched the disparities in advance directive laws across the U.S. The research was recently published in the New England Journal of Medicine, and here to discuss is one of the lead authors of the study, Mayo Clinic Pulmonary and Critical Care Fellow, Dr. Erin DeMartino. Welcome back to the program, Dr. DeMartino. It's nice to see you again.
Nice to see you too. Thanks for having me.
So tell us about this research, Dr. DiMartino, because it sounds like when it comes to advance directives, there's a fair amount of disparity among the states. We're far from all the same.
That's correct. And it really came to light for me during the course of my training as I moved from one state to another and practiced in different hospitals. I would notice that similar patient care situations were approached differently in different jurisdictions. And when I would ask about that, I was referred to the statutes. And I don't think very many people actually go and read the statutes. But eventually, because I encountered this so many times, I decided to go look for myself. And that kind of opened Pandora's box.
Yeah, Pandora's box for sure. If it's confusing for you as the physician, I can't imagine what it would be like for the patients.
Sure,
and family.
I think a lot of patients and even physicians who practice in one place for most of their careers are unaware of the degree of heterogeneity state by state.
What does that mean?
Meaning that
That's a medical word, isn't it? Yeah, good for you.
Meaning that.
Differences.
Yeah, differences that can occur in a very similar patient encounter in one state versus if you were to cross the border 5 miles away and get your care in a different state. The same situation may be approached very, very differently.
Well, whoever made that decision that the states shouldn't all be the same and that this should be on a federal level rather than letting each state decide how they wanted to do their advance directives?
Well, this has really evolved over time as a state issue. The first advance directive laws were passed in California back in the 1970s, and since then, every state now has some kind of statute or law that addresses decisions for somebody who can't make their own decisions. Most of those are in the form of an advance directive law, but some of them also cover people who don't have an advance directive and don't have a guardian or somebody appointed by court to make their decisions. And those are what we call default surrogate decision makers. So the people who are those 70 or between 70 to 80% of American adults who don't have advance directives and don't have a legal decision maker are covered by these other laws.
What is that the key problem that you found? Is that even just people having an advance directive?
It's certainly a problem that when somebody becomes sick, their doctors often don't know to whom they should turn for making decisions.
So everybody really ought to do this, right? And there's a lot of people out there right now, all of us baby boomers, who ought to be doing it today, if not yesterday, right?
And I wouldn't necessarily only shine the spotlight on one generation. I would say that it's important for a 20-year-old to complete a directive as it is for an 80 or 90-year-old, meaning that at least, at the very minimum, it's helpful for us to know who you trust to make decisions for you if you were to become suddenly ill.
Is there, after you've gone through this research now, do you feel that there should be a national standard, or do you feel like there should be a guideline or a framework for each state to, because I'm kind of like the states' rights kind of thing, but I can see how in this case it might not be the best thing.
Yeah, it really depends on your philosophy, I guess, about government in general, whether you believe that states or local communities should be guiding these types of decisions for their own citizens, or whether there should be a more universal approach. Certainly having a universal approach say, an advanced directive format that was recognized in all states, which does not currently exist, or a more general approach to these types of decisions that's acceptable across all state lines, would make it easier for policymakers and people who are trying to design best practices or recommend ways of dealing with certain types of medical therapies at the end of life, if we had some kind of universal way of approaching these issues.
So from a practical standpoint, let's say that I have an advanced directive in the state of Minnesota. I'm down in Florida. I get critically ill. Are you saying that the advanced directive that I filled out in the state of Minnesota is not effective in the state of Florida? They wouldn't follow what I said in Minnesota?
So that's an excellent question. Almost every state has what we called a reciprocity clause, meaning that they will recognize an advanced directive that's been filled out in another state that talks about different care preferences and things like that, as long as those care preferences don't carry it over the line of something that would be illegal in one state that would have been legal in your state of origin, specifically like a physician-assisted suicide type situation.
What about if you fill out your advanced directive and then you retire and move to another state? You have a different home state then. Is the same situation?
So,
it can't be reciprocity because you're moved to a different state.
So ideally you would fill out a new directive that follows that state's language. Some states have specific language they require. Some states actually have specific forms that you need to use. But ultimately, if there is some kind of legally documented expression of wishes, it's usually respected even though it's outside of the normal jurisdiction, just because it's actually so rare to even find legally documented wishes, patient wishes.
Physician-assisted suicide, now how many states? Isn't there 4 or 5 only?
I believe so.
So if we had that law in Minnesota and I went to Florida, they wouldn't do that in Florida, even though it was legal in Minnesota.
That's correct. Yes.
All right. You like you're an internist. You see critically ill patients. What do you think about physician-assisted suicide?
I believe that my oath as a physician is to alleviate suffering, and if I can't alleviate suffering, to provide as much comfort and care to patients as I possibly can. And I believe that it is outside of the scope of my responsibilities as a physician to assist a person in ending his or her life early.
You and your co-authors, what did you think differently about this after your research was done or before you started about advanced directives? Did it change the way you thought about what you're doing?
In terms of my own practice?
Mm-hmm. Yes.
Certainly, because this issue comes up very frequently. Minnesota is one of the states in which we don't have this rigid hierarchy we call, or a ladder, where if somebody doesn't have an advanced directive, you go first to the spouse and then the adult child and then their sibling, for instance. Whereas in my co-authors' states, in some cases, they have a very rigid ladder that they must follow. And so just talking to them about the ways in which they approach similar patient situations is quite interesting, because in Minnesota, you may have 6 or 7 different people who become recognized and become a part of the decision-making process, whereas in another state, that mantle of responsibility falls squarely on one individual's shoulders.
All right, bottom line is you got to do it. Get an advanced directive no matter how old you are, no matter where you live. Advanced directives and how they differ in different states in the U.S. with Dr. Erin DeMartino. Thanks so much with Dr. Erin DeMartino. Thanks for being with us.
Thank you.